Gabrielle, I'm the nurse who's going to be doing the assessment today. Can you state your name and your age for me?
Gabby Chaz, 25 years old.
Hi, Gabby. So today you're in for a abdominal and renal assessment. So it requires a lot of, listening and palpating different areas of your body. So if at any moment you need me to stop or slow down, please let me know. Okay? So I'm going to sanitize my hands and then you can lay on your back for me so we can start. All right. Gabby, we're going to start with the visual part of the assessment. And for that, I will need to lower myself to the level of your abdomen to check for contour and symmetry. Okay. Now I'm going to assess for any scars, any striae, and to make sure the color of your skin is normal. I also will be assessing for any pulsations, and I do not see any visible peristalsis. Your umbilicus is midline to your abdomen area, and there is no redness, no inflammation, or hernia noted. The next step is auscultation, which means I'm going to be listening to your abdomen. Okay? Right now, I'm going to start with your right lower quadrant on the iliocecal area. Here, I'm going to listen with the diaphragm part of my stethoscope. Because normal vowel sounds are high pitch, so they can be heard with the diaphragm part. Okay, and now I'm going to do vascular sounds. With that one, I have to listen with the belt part, and I'm going to do aortic, right renal, left renal, left iliac crest, right iliac crest, then right femoral, and left femoral. Now that I have listened to your vowel sounds, I'm going to move and do some percussions. We did not do that before because sometimes percussions or pushing on your abdomen can increase the vowel sounds. That's why we do auscultation first. Okay, so now let's do percussions. Okay, and then I'm going to do some palpations, and this one's going to be light palpations. Any tenderness?
No.
What about here?
No.
Okay, now I'm going to do deep palpations, okay? Any tenderness?
No.
Here? Okay, how's that? Normal? Okay, Gabby, now I'm going to palpate here your liver, which I'm going to put my hand under you here, under your rib cage. Take a deep breath and out. That's normal. And now I'm going to do the same thing on the other side for your spleen. Take a deep breath in and out. Okay, that's normal. And I'm going to do your kidneys now. I'm going to start with the right one. Tenderness. On the left. And tenderness. Okay. Okay, next I'm going to be performing what we call specialty tests. We'll be pushing on different areas. Here I'm looking for any rebound pain. We do this test to check for appendicitis. Okay. first one is the Murphy's sign. And take a big deep breath in, out. Any pain? Okay, now I'm going to move to your left. This one is the Blumberg's sign. Take a deep breath in. Any pain? Now, this one is the McBurney sign. Take a deep breath. Any pain? Okay, Gabby. The last one is the Ilioposis muscle test. So I'm going to ask you to pick up your leg one at a time once you feel the pressure here. Okay, very good. Any pain? What about with this one? Okay, very good. The last thing I'm going to ask you to do is to sit up for me and look that way. Okay, good. So here I'm going to do what we call the CVA test, which stands for costovertebral angle tenderness test. Okay? Any tenderness there?
No.
Any tenderness there?
No.
Okay, here I'm just checking for your kidneys, making sure there's nothing wrong with. Okay? Okay, Gabby. That concludes our assessment. Thank you very much.
Thank you.
This is report for a 25-year-old female that came in for an abdominal and renal assessment. While standing on the right side of the patient, we started off with visual inspection of her abdomen at eye level. Her abdomen contour was flat with bilateral symmetry, without any scars or striations. No visible pulsations or peristalsis were noted, and her skin color was appropriate for her race. Her umbilicus was midline without any signs of redness, inflammation, or hernia. We proceed with auscultation for her bowel sounds with the diaphragm part of the stethoscope. Bowel sounds were present, high-pitched, normal in all 4 quadrants. Then bilateral auscultation of the vascular sounds was done with the bell part of the stethoscope at the aortic, renal, iliac, and femoral arteries without any thrills noted. General percussions was performed with resonance and tympani heard while in a sitting position. Costovertebral angle tenderness test was performed in direct fist percussion. The patient denied any tenderness. Then light and deep palpations were performed without any complaints of tenderness. Unable to palpate her liver, spleen, or kidneys, she also denied any tenderness while assessing those areas. To conclude the assessment, specialty tests were performed with negative Murphy's sign, negative Blumberg's sign, negative McBurney's sign, and negative Ilioposis.